Thank you, Governor Reynolds. I'd like to take a few moments to talk a bit about this newly recognized condition that we're calling multi-system inflammatory syndrome in children. This is something that we're following very closely in order to learn more about. Now, so far, children have made up a smaller proportion of the reported COVID-19 cases. And thankfully, reports of children becoming seriously ill are very rare. However, late last week, the Centers for Disease Control and Prevention shared a message alerting healthcare providers and public health professionals to this new kind of inflammatory syndrome that seems to be associated with COVID-19. Friday afternoon, the Iowa Department of Public Health did receive 2 potential reports of this new syndrome. These reports are in children in eastern Iowa who are currently stable, and we're working with our clinical and local public health providers to gather more information. Now, what we know so far about this syndrome is that it appears to cause fever and signs of inflammation throughout the body. You might have heard this compared to another kind of rare inflammatory condition in children that we call Kawasaki disease. These 2 syndromes appear similar in that they both seem to cause what we call post-infectious inflammation, meaning that several weeks after a likely infection, people might develop signs of inflammation throughout the body. We do think that this is a new condition, though, distinct from Kawasaki disease. Now, like so many things with this response, this is an example of a place where we need to learn more. So in order to help do that, Director Claiborne and myself have made this new disease a mandatory reportable condition here in the state of Iowa. This allows us to receive these reports from clinicians and public health professionals and allows us to gather more information and better understand this condition and how we can manage it. In the meantime, we want to remind children and their families here in Iowa to continue to do all the good things that you're already doing. That includes following public health guidance, things like frequent hand washing, social distancing, and the use of cloth face coverings when you're unable to maintain a distance of 6 feet. And finally, we just want to remind everyone, including children, that it's important to stay up to date with your routine care, including vaccines.